In our rapidly urbanizing world, implementing the right mix of green, blue and grey infrastructure can significantly improve our living environment and positively impact our climate. But what about our personal well-being? We've long understood the benefits of living near green spaces and are starting to uncover those of blue infrastructure, like rivers and lakes. However, no comprehensive assessment has considered the potential of green, blue and grey infrastructure to improve urban well-being and guide policy decisions to reduce inequality. To make matters worse, marginalized and deprived communities are most likely to be affected by poor quality infrastructure in the local neighborhood, and their voices are also less likely to be heard in research about the environment and health. So with increasing inequality and a growing rate of depression among adults, the question becomes even more pressing. Can local authorities and residents maximize the benefits of their neighborhood's green, blue and grey infrastructure to improve well-being and reduce disparities? Researchers from UWE Bristol, funded by the Reclaim Network Plus, have undertaken a study to explore the relationships between green, blue, grey infrastructure, GBGI, and various health and social outcomes in Bristol neighbourhoods. Using quantitative surveys on residents' quality of life, their aim was to inform local policy on the relative benefits of these infrastructures in improving health and social outcomes, while reducing urban inequalities. The GBGI features which were considered included proximity to green and blue spaces, for example parks and lakes, as well as features of the built environment, such as leisure centres and listed buildings. Local resident satisfaction with green spaces is a key predictor of well-being. A 1-point increase in satisfaction was associated with a 28% increase in neighbourhood satisfaction, a 6% increase in life satisfaction, and a 5% rise in reporting high levels of well-being. This highlights the importance of looking at resident satisfaction with local green spaces in terms of perceived quality, safety, and accessibility, rather than focusing on physical features such as vegetation coverage, proximity, or size of green spaces. Findings indicate that GBGI satisfaction significantly predicts neighbourhood satisfaction, more than socio-demographic factors. For life satisfaction and well-being, both GBGI provision and satisfaction are significant predictors, though socio-demographics also play a role. Interestingly, there are weaker associations between GBGI variables and self-reported general health. Satisfaction with green space emerged as the most consistent predictor of positive outcomes. Notably, areas in South Bristol, despite having similar green space access as North Bristol, reported much lower satisfaction. This highlights that provision of green spaces alone is not enough. The quality and usability of these spaces are also important factors to consider. Residents and communities, especially in highly dense areas, should focus on enhancing the quality and accessibility of their local green spaces. This can lead to improved air quality, regulated temperatures, and better overall well-being. On the other hand, policymakers and local authorities need to prioritize not just the provision, but also the quality and safety of green spaces, ensuring they are welcoming and beneficial for all community members. If you would like to help create healthier local communities, consider joining a Friends Of group to help improve the quality of your local green spaces. For more information, please visit www.reclaim-network.org.